Hello and welcome to Sensei Podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei Podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello everyone and welcome to Sensei Podcast. It is my great pleasure to introduce Dr. Stelios Pyxaras from Fuerth in Germany, who has been one of the new generation expert CTO operators in Europe and around the world. So Stelios, thanks again. Welcome to Sensei Podcast. It's a great pleasure to have you join us today.
Thank you very much, Mano. This is a very honorable invitation I received from you. I hope I won't disappoint you.
No, it will be perfect. And maybe always ask everyone, how did they decide to do this? So how, for example, in your case, how did you decide to become a CTO and complex operator?
Well, I mean, probably it's something personal to each and every one of us. I actually decided this during my interventional cardiology fellowship in Belgium, in Aalst, in OLV. There I actually had the opportunity to be exposed in very high volume of procedures. And also I had the extreme luck to find myself among several experts, not only on the field of CTO, but only on the field of interventional cardiology in general. So it was just like being in the Disneyland of interventional cardiology of Europe there. So I had the opportunity to meet Bernard de Bruyne, who is the father of FFR, William Wines, who is the president of EuroPCR. I did some CTO procedures with Guy Hendricks, who actually performed several procedures with Andreas Grunzig at the time. And I also had the luck and the opportunity to be trained in CTO PCI by Emanuele Barbato, who is the current president of the EPCI. So a tremendous luck, because it was not planned, to be exposed in such an environment and had the opportunity to meet and have everyday talks with this kind of people. Additionally, they were performing regularly local workshops in CTO PCI, and at that time also Masahisa Yamane was a visiting professor in that clinic. So he actually came there and performed CTO PCIs with the staff, and of course, as I said, it was a marvelous experience, which lasted approximately 3 years, and I would not change it with anything in this world. I remember the very first year of the fellowship, I actually joined Emanuele Barbato, who was performing at that time some CTO PCIs, and he taught me everything about that. In the beginning, I was not actually understanding what he was doing. And I saw a lot of material that were not known to me up to that time. I had the beginning of my interventional cardiologist experience began in Italy. I was trained as a physician, and then I was trained as a cardiologist. But back then, I did not have any kind of experience to microcatheters, specific CTO wires, or things like that. So it was actually a very impressive impact for me, as you can imagine at that time. That was more than 10 years ago. It was 2011. And I really remember it as it was yesterday, actually. It was a tremendous experience.
And then, so you got the first impressions there, you got some initial training. But then to do this, obviously you have to learn and do the cases yourself and become good at it yourself. So how did you manage to be able to do these procedures and get better as you have and grow and become better and expert in the field?
Yeah, absolutely. I mean, this is a great question. Also, with respect to other people that they want to do some kind of similar experience and they want to learn the CTO PCIs. I mean, it's very important to know that. What had happened in my case was I actually did several CTO PCI back then as a, let's say, first operator, of course, under the supervision of the big guys there. And then as soon as I went to Germany, I did have a consultant position. And then, of course, I tried to apply, first of all, the teachings that I have during the fellowship, and then to expand this kind of experience that I accumulated back then. So I continued to perform, first of all, undergrad CTO PCIs, and afterwards inviting proctors in my centers to train me. I remember back then Yang Soo Jang from South Korea and did some procedures with me. Afterwards, during a process that lasted a lot of years and last up to now, I mean, we never end up learning. I managed to learn also ADR in some kind of point because I was not really happy with some procedures that were not successful, and I had the perception that probably ADR would be a nice addition to antegrade and retrograde CTO PCI. So the possibility to work in relatively high volume centers with a lot of CTO PCI procedures and trying to learn, continuously learn from workshops, going to congresses, getting informed. I mean, I was really motivated to stay behind of this field, and I really loved what I did.
And then how do you deal with the challenges, the complications that invariably happen with this area?
Well, nobody likes complication, of course. I mean, and they still sometimes happen, despite the fact that we all try to be really careful with the procedures to not expose to the patient to unnecessary risks and so on. First of all, I think the most important part of dealing with a complication is to be prepared before the complication happens. So it's very, very important, and this is what I did to every CTO program that I initiated, is to have always in mind and speak with the staff, speak with the nurses before actually embarking to such a program. How do you prepare and which kind of materials do you have to have on the shelf in order to quickly be able to use them when the complications occur? So be able to have the pericardial puncture kit, be able to have coils on the shelf, have access to in the intensive care unit in cases that things goes bad. And probably the last few years we learned also to use hemodynamic support in CTO PCI, particularly in very sick patients that of course are not surgical candidates. And I believe this kind of support probably makes a difference in patients, particularly with let's say, low ejection fraction and a lot of comorbidities. So be prepared, first of all, and try to deal with the complications, maintaining a Zen approach to the procedure, trying to stay as calm as possible. I mean, we interventional cardiology have a let's say, a plus point in this case, because we are used to maintain calm because of acute myocardial infarction procedures. And let's say when in an elective procedure happens something, we have a step up to the acute mindset at the end.
Perfect. And then as you were learning, were you also teaching the staff? How did that work for your technicians and nurses who participate in those cases?
Yeah, I mean, probably you know that from yourself, when you go to a new place and you introduce some kind of new complex procedures that last more than 2 hours, nobody's really excited. So that means you have to have, since the very beginning, a really sincere approach with the staff. and explain to them, sit with them, make several meetings, actively involve them, and you will be amazed to see how people are getting interested on the procedures by the passing of the time, and they are really enjoyed it. But I think it's key really to be able to present it as a teamwork and to involve staff as much as possible. And of course, the other thing is that they notice after a while that this has a real benefit to the patient, and they appreciate it also that. So I mean, other staff, other physicians getting interested, of course, the feedback that we get from the patients and their families. So it's, let's say, ideally, it should be a holistic approach.
Mm-hmm. Perfect. And I completely agree with you that it is a team effort and that it takes understanding of why we're doing this in the first place, which is to help the patient. Now, are there any cases that have really left a mark on you that you remember vividly that taught you a lot, either good or bad ones?
There are several cases probably during these years. I will probably not remember all of them. There are positive cases, of course, that mostly the positive feeling that they leave is after the procedure, after you get some feedback from the patient. And there are a lot of patients that send me cards from their vacation that they did not manage to do from many years. Or I had a month ago a case from a colleague anesthesiologist who had a CTO, and he came to me, and after the recanalization, he sent a card by himself hiking and being around doing things that I even personally do not do at this kind of point. So this is the most positive part that I leave you behind. From the technical point of view, there are, of course, several very challenging procedures. This is like running a marathon. It's not 100 meters, and you know that. And during the procedure, probably you need to have the endurance to bring the procedure up to the end. And you have to invent yourself to be mentally flexible and trying to upgrade between the techniques as you taught us from the hybrid algorithm. So switch fast and trying to mix a lot of techniques as you first instructed us. And I'm trying to follow this. And of course, it is not always easy. But we try to follow this kind of advice that you gave us back at the time. And this has an absolutely positive impact, not only to us as physicians, because we manage to be fast as possible with this kind of procedures, but also in terms of patient safety and efficacy regarding the procedures. There are other procedures which, of course, as you said, complications are a little bit higher compared to normal PCI. We have to be aware of that. And there are some procedures that they really left a mark on me. I characteristically remember some years ago there was a procedure where we have a typical CTO complication, which was a perforation, and the patient went to pericard tamponade on the table. So I performed the pericardial puncture as it was to be done in this case. Coiling was not an option because there was not visible bleeding on the coronary vessels, but you can show in the echo that the pericard tamponade was present and was quite massive. And after puncturing him, he was stable and transferred him to the intensive care unit. And then we had some discussions with colleagues back then at the time, and there was some insistence to transfer him to a heart surgery department. And we did that, and unfortunately, he was operated, and after the operation he had a stroke and passed away. So sometimes even the decisional pathway that we follow has consequences, if not immediately, maybe after the procedure. So this was a quite humbling experience, and let's say of course, something remains behind, and it made me think of many things afterwards.
And as you say, these are all learning opportunities as well, right? And even the best operators will have problems and complications happen. And the way that this is best done, I think someone was saying that the best way to use them is to actually learn from them and apply the learnings for the future procedures to benefit the future patients as well.
Absolutely.
Now,
absolutely.
do you get nervous? Do you get anxious before the cases? You do some very complex cases. How do you manage the mental part of it?
Well, I sincerely must say that during the last maybe years, I'm not nervous with the cases. I mean, preparation is really key, and I personally learned all these years to prepare myself good for the procedures, and in order to be able to save time, save radiation, and have a clear strategy before the beginning of the procedure. So I don't think I am anxious before the procedure, or I have stress or things like that, or even during the procedure. You actually learn all this year to control yourself, to have this kind of, as I said, Zen approach, to be absolutely isolated from what happens, because it's not about you, it's about the patient, and you have to have character, to demonstrate character, and to keep calm during the procedure, because you owe that from a safety point of view to your patient up to the very end, even if the things go bad.
Absolutely.
Let's say, and afterwards preparation, of course, how to prepare for a CTO procedure is very, very, very important in these cases.
How do you keep your focus during a complex case? This can be, as you said, 2, 3, 4 hours. How do you keep focused and in the Zen approach, as you mentioned before?
Well, I mean, probably it's a habit at the end. I mean, sometimes, as I said, even in acute myocardial infarction, the setting is probably much more hectic, much more stressful, and you have to deal with several kind of things that happen in milliseconds, let's say. So CTO is an elective procedure, should be an elective procedure, which can have some complications, and as I said, you should be prepared about that. So let's say it's probably not effortless to maintain focus, but it derives probably from the preparation you did before, and from the interest you have on the procedure, and from the interest that you have that the patient remains safe and good up to the very end. You have, of course, the help of your staff. You have the help of the people that are outside of the cath lab, and they are controlling the parameters. It's not a single man job. And you have the friends or the fellows that are helping you during the procedure, and they have another pair of eyes or more eyes. And this helps to maintain the focus. I mean, the important thing is always to get help, and to not rely just on your strengths, because if you do something just alone by yourself without relying to other people, you're probably going to fail. So be able to ask for help and to receive help during the procedures, and of course, as one of my mentors said before, trust everyone, control 2 times.
Sounds like a plan. So, Stelios, with the people you train, the fellows you have, the other people that you train in meetings, etc., how do you assess the potential of a student or a fellow? Do you look for their character, their technical skills, their judgment? Can you tell if a person is going to be a good CTO operator or not?
Well, let's say mostly people that want to be trained by me, and they come to and they say to me that I want to be trained because I want to do this thing, they are actually having already the motivation to do that. So I think motivation is one part, and grit is another part. That means perseverance and persistence and a lot of work. Probably talent does not play a big role in this kind of thing. I personally believe that probably it's perseverance that makes most of a CTO operator, of a complex PCI operator. That means if they really want to do that and they love this thing and they put their heart on this, I think they are likely to succeed. Probably there are also a minor percentage of cases that are not, but I personally am not aware of any of this. I mean, personally, I believe perseverance and hard work will make the trick.
Perfect. And then how many cases do you think it takes for someone to become good at doing CTO or complex PCI?
To be really good, I think this is a never-ending process. I think I'm always still learning, and it's not about my fellows that probably are more talented than me, but I think that one should have also the humbleness and let's say the mental setting to be able to put himself or herself on a discussion, always during a procedure, get feedback from a lot of people, and do not think always that one is right and has the magic touch and things will go good. Things if you do things, sometimes will go bad. That means that you need to maintain concentration and you need to have an openness of mind in order to achieve this kind of goal, as you mentioned.
Perfect. And how do you keep yourself in good shape for these procedures, since they can be long, wearing lead, etc.? Do you exercise? Do you do other things? How do you keep physically and mentally strong?
Well, in our job, of course, we are doing CTO PCIs, and this implies that we have to stay some hours on the table with a lead skirt. And accordingly, if you do not think it before, you will think it afterwards, which is what was also my case. And at the very beginning, I neglected it, and during the past years, I exercise regularly in order to perform some core strength exercises, and of course, some cardiovascular exercises that are really important in order to maintain blood pressure in an acceptable level also in our age, let's say.
So do you run? Do you go to the gym? Do you bike? What do you do?
I mostly go to the gym 2 or 3 times a week. I try to go to the gym 2 or 3 times a week. And I must say that I also have the possibility to do some running in my own apartment, which I have a treadmill. And that's are more or less the things that I actually do currently. There are some days that I come really, really, really late at home and probably was not awake early enough to do some exercise. So these are lost days, but I believe everyone has some of them.
Sure. And then Stelios, in terms of the things that you're doing right now, what is the most exciting thing for you?
It's definitely training and of fellows, I think. It gives a lot back. It's a very interesting process. I have been fellow myself, and not a lot of time ago. And the thing that one of my greatest mentors suggested me is that I should be a mentor myself. So I kept his advice, and I tried to communicate and to teach people everything that I know. Maybe they are not enough, but I think that people need to get some experience, and probably they will find their own way, which is probably better even than mine. But I really enjoy giving feedback to younger people or even other colleagues that I'm proctoring. So I think this is the most important part of our work. And the other part is actually clinical research, because I believe that in order to be able to give excellence of care to our patients, we have to combine not only clinical practice, but also the possibility to be actively involved in clinical research. And of course, you are the one that first did this kind of effort, and we all in the CTO PCI feel we should be grateful to you and to give us this kind of paradigm. I mean, I had a lot of great mentors during my experiences, but let's say having Manos Birlakis, who actually was from across the ocean, even at the time I did not know you, but having this kind of paradigm, this kind of example that this had this kind of approach was really useful, I think, not just to me, but also to a lot of other fellows at that time that wanted to have some kind of orientation in their life and in the interventional cardiology field. That is very important.
Well, and I think you've done a great job, actually. A lot of the papers that you published lately, your intervention, dual loop microcasters, other approaches. I think this can be very useful, trying to break things down and explain to people and make it more standardized on a step-by-step. So how did you get started on that? I know you worked with Barbados, some very prominent people, but how did you learn to write and become good at this endeavor?
Well, first of all, let's say there are also other people that helped me during this kind of process, and of course I'm very grateful to my personal friend Kambis Masayeki, who actually have been actually mentoring me also sometimes when I needed some of his help and some of his advice, and was really great to have someone in the same country which has the same kind of interest and so big of an experience, far bigger than mine. And of course, previously during my fellowship in Belgium, I learned to write down papers, and I actually had an active interest on biomedical statistics, and I've studied them by myself during these years, and I actually learned to perform statistics using statistical programs by myself for the papers that I've published afterwards. So that was this motivation that derived from this kind of very enlightening people that they were doing it since ages, and being in an environment like that, as I said before, really kept me motivated and taught me a lot of things. So I owe a lot, all of them, not only for what they give me, but also for, let's say, the mental background behind this.
Perfect. And what is next for you? What are the things that you're planning to do next?
Well, I think that I would like to advance more or less this kind of educational process that we are actually organizing, not only locally, but we're trying to do it in international level. So we have several ongoing plans regarding workshops and training of other people. And I would probably like to be more involved in scientific research in the field of CTO PCI, because I think that our field probably needs more randomized trial. We know that we have the possibility to enroll probably some patients, but the thing is that in CTO PCI the enrollment is really difficult, because patient selection and inclusion are two issues that will probably penalize CTO PCI for a long time. I mean, there were a pair of randomized trials already, you know them, but the results and the background behind them are not really convincing, and I think this is a major issue regarding of which patients are we going to treat. So if we're going to treat patients that the CTO is not of high importance, probably the results will not be satisfactory. We need to have this mindset and to be able to include patients that really need to be treated with these procedures, actually the patients that are grateful after the procedures for relieving of symptoms, and why not after for improvement of prognosis.
Perfect. Thank you, Stelios. And then in terms of other things, what is your favorite book or a favorite movie that you have?
Well, I must say I've read a lot of books when I was younger. The last period, I'm not currently reading a lot. I remember a book from
Or a movie.
From Umberto Eco, The Name of the Rose, who is an Italian writer. Probably you know it. It was also a movie afterwards.
Sure.
And my favorite movie of all times, it's The Godfather with Marlon Brando. So it's a no-brainer for me. It's the complexity and the interpretation of the characters. It's mind-blowing.
Wonderful. So, Stelios, what are you most proud of up to now? The things you've done personally, professionally?
Well, proud. Well, I think I'm proud of my family and the sustainment that they gave me all these last 24 years that I'm abroad from the distance, because they are still in Greece. And probably I'm also proud for the people I met, and I'm also grateful about them, because since the very beginning I was no one and they gave me an opportunity. And I'm also proud for the fact that these few things that I achieved it based on principles, and this gives you probably some kind of other satisfaction in this case, I think. At least how I perceive life.
Perfect. No, I mean, that's very important and I think shows very well. And then if someone approached you right now in terms of the younger people, someone who wants to learn to do these procedures, what would be your pieces of advice? Like if you had to summarize them, 2 or 3 pieces of advice that would help them go through this learning process and get good.
Well, I think the best piece of advice is to see what other people are doing. So leaders of the field, follow them. And that's why I think this kind of podcast that you're organizing is very important, because I must say that before that I received the invitation from you, I saw the podcast of Professor Yamaileva and myself, and I was really excited about hearing of his own experience and so on. So I think this is a major issue. I mean, I would advise them to see what other people did. They do not have to absolutely follow them. It's not necessary. They should find their own way. But I think it's a really good piece of advice just to see what other people did in these cases. And of course, if they do this thing with heart and they are motivated, I think they can bring it on. I mean, they have to have a positive approach towards their future, because it's all there and it's all bright.
Perfect. I think you're right that there is a lot of need for more advanced, complex operators who can do these complex cases, and they will likely continue to be in the future as well.
Absolutely.
So, Stelios, thank you. Thank you again. Thanks so much for taking the time. Excellent learning points for everyone. Again, congratulations for everything you have done. It's been a pleasure working with your multiple projects, and look forward to doing that in the future as well.
Thank you very much for the invitation, Mano. As I said before, it was really an honor for me, and keep up doing what you do. You made all of us proud, very proud.
Thank you for listening to the Sensei podcast.